probably 10 years ago, there were no real good therapies for erectile dysfunction, certainly no good oral therapies. We did have intracavernosal injection, which is where you would inject a medication into the penis with a needle to give erections, and that worked well, but obviously people are not excited about placing a needle into the penis.
We're in a remarkable time. In the last 10 years, we've seen dramatic steps forward. Really, up until the introduction of Viagra, there were no truly effective medical therapies. With the introduction of Viagra and now its associated medications, we've seen a shift in how erectile dysfunction is treated.
Pfizer initially developed Viagra, sildenafil, as a coronary artery drug. It was used to try and dilate the blood vessels to the heart so that would improve blood flow to the heart and decrease angina. Unfortunately, it did not work very well for men, but they had an interesting side effect that Pfizer has obviously marketed very differently. When it happened, these patients had better erections. It didn't work very well for their heart, but it helped their erections. One problem that they did have is that patients would not turn in their medications, and some patients actually broke into the infirmary to get their medications and steal the medications.
An erection involves a very intricate cascade of events. You need the visual stimulation, you need the mechanical stimulation, so there are definite cerebral triggers that are involved in sustaining an erection when a patient is awake during the course of the day. There is a cascade of chemicals that are released, something called nitric oxide, which then stimulates another chemical called cyclic GMP. And the presence of this cyclic GMP causes the muscle fibers within the erectile tissue of the penis to relax.
What these medicines do, the phosphodiesterase inhibitors, they block that breakdown of that signal to have an erection. So we have an erection that lasts longer and usually is a bit better.
All these medications work, give or take, within 30 minutes to an hour of taking the medication. It's very important that if you simply take the medication and wait for an erection, or if you just have visual cues, you're going to be disappointed. You need manual and physical stimulation to get this cascade of events to occur. But we typically suggest to take it 30 minutes to an hour before you engage in relations, and that would apply to all three of those medications.
Levitra and Cialis are in the same classification as Viagra, but they are somewhat different in their pharmacokinetics. And what that means is that the amount that is absorbed, the strength that it binds to the receptor, and the length that it is in the body and active is different. For Levitra, it may act a little bit more quickly, maybe in a half hour, and last for about 4 to 5 hours.
I believe efficacy is somewhat similar with some caveats. Levitra, there are some studies that suggest that it may be a little bit more effective in diabetics, but overall efficacy is similar.
There are a lot of different ways we can measure erections. We can measure the pressure in the erectile body itself, and none of them are going to do that. So they're all fairly subjective, and they're based on patient questionnaires. So we're never 100% certain who's better than the other. But using at least patient information, we get a good idea.
The most typical side effects are indigestion or dyspepsia, flushing, stuffed nose, headache, blurry vision, or bluish vision. And Cialis has a slightly greater incidence of back pain and muscular aching. But here, too, they're all typically less than 10%, and I don't mean to infer that you're going to have all the side effects. And it's tremendously variable. Some patients have absolutely no side effects. Others will have a combination of the side effects I just mentioned.
Now we know people who have significant coronary artery disease or use nitroglycerin or nitrates should not use these medicines.
And I always like to give the analogy, it's perhaps a better analogy for the northern climates, but an older gentleman has been sedentary all fall. This is the first snowfall of the winter. And he takes his shovel and he goes out and he shovels his driveway. The exertion and the activity of shoveling the driveway causes him to have a heart attack. Well, it's not the shovel that was harmful or dangerous. And that's the analogy I use when discussing these medications. It's not the medication that predisposes the patient to a cardiac event or a myocardial infarction. It's their underlying heart disease that does so. These drugs are actually extraordinarily safe. They have been studied extensively, and in healthy patients, there should be no concerns in that regard. In older men, enlargement of the prostate and voiding dysfunction very often coexist with erectile dysfunction because, after all, the two conditions afflict an older population, so they can be concurrent. And in this regard, there is some concern regarding the use of Levitra, Viagra, and Cialis, as well as the more commonly used medications for enlarged prostates.
Hormone replacement therapies are where men have hypogonadism or low testosterone. That can affect libido and erectile function. And if men have low testosterone, we can replace the testosterone to try to get them to more normal levels so their libido returns and they improve their erectile ability. We can do that with pills, with shots, with patches, or with gels. The pills are not very effective. In fact, the side effects are very significant. They create hepato or liver toxicity, so we don't use them here in the United States. The shots are not very convenient, and they give you a dose once a month, which is a super dose, and then there are trough levels or very low levels at the end of your cycle. The ideal way to replace this would be every day to either place a patch or a gel on the skin, and that will deliver the medication in the morning and then slowly taper off in the evening, which is the normal pattern that men have throughout their life. And we can do that pretty effectively now.
This is an example of a penile vacuum pump. This is a cylinder that's placed over the flaccid penis. Prior to placing the pump over the penis, a rubber band is placed on one end of the cylinder. This is then placed over the flaccid penis, and you create suction. You create a airtight seal, and then with a pumping motion, you create a vacuum by withdrawing the air from the cylinder. And with that, because of the negative pressure, the penis becomes erect. And then when you achieve an erection, you slip the rubber band off the device onto the base of the penis to contain the blood. It is somewhat awkward. It can be somewhat uncomfortable, but it is actually a very safe method and alternative for patients with erectile dysfunction.
I think it's a good option for couples who have been together for a long period of time. Some people do consider it a contraption. Now, if you're a young single person, that would not be obviously an ideal option for you. But I think for couples who have been together for a long period of time, it's an effective therapy that's not terribly invasive without any new medications.
This is an example of an inflatable penile prosthesis. It's a silicone device that's surgically implanted through a small incision. Implantation in good hands takes about 45 minutes to an hour, and there's a relatively quick recovery of about a week or so. This, again, an example of an inflatable prosthesis. That means that this prosthesis can be inflated when the patient wants to be sexually active and deflated, so that no one else is aware that there's a prosthesis in place. It's more physiological and more natural than a implant that's always erect. It involves a pump that is placed in the scrotum. It's two cylinders that are placed in the penis and a reservoir which is tucked away in the abdomen. Of course, none of this is exposed once it's implanted. And in the deflated state, one would be hard-pressed to ever imagine that someone has an implant.
Men usually choose that type of a device, an inflatable device, because if they want to go, say, at the men's club and have a shower, nobody will know that they have this device in place. The advantage of it is that they will have an erection within 10 to 20 seconds when they want to have an erection. It is reliable, it's spontaneous, and it's probably one of the more natural ways to have an erection in that women will not know the difference. It is a reliable form of therapy. It is spontaneous, and it does work very well.
In contrast to the inflatable prosthesis, there is something called the malleable prosthesis, which consists of two rods that are somewhat rigid but not completely so. I like to say it has the consistency of a metal hanger. These are simpler to implant, but are not as natural in appearance, in that the patient will always be erect. Because they are somewhat malleable, the patient can shift it out of the way to one side or the other. So it, of course, is not necessarily prominent in the forward position.
There's a very high satisfaction rate for men who have inflatable penile prosthesis, over 90%, which is higher than most of the other therapies. I think you have to educate, or patients have to be educated well to be satisfied. And if a patient is properly educated and motivated, then a prosthesis is a good option for them.
Here's the implant where the cylinders are deflated. When the patient wishes to inflate the prosthesis, he activates the pump with a series of compressions, transferring fluid from the reservoir to the cylinders. And as you can see, the implant becomes erect. And considerable rigidity can be obtained and maintained for as long as the patient wishes. And then when he has completed his activity and he wishes to deflate the prosthesis, there's a deactivation button that is compressed. The water is transferred back from the cylinders to the reservoir, and the implant becomes deflated.
Patients still use injection therapy, not as much as they used to. Diabetics are more likely to use this, as Viagra, Levitra, or Cialis may not be as effective for them. The injectable medications are much more effective. Diabetics are used to using needles, so they may be more apt to use them. So still used, but not as much as in the past. U stands for medicated urethral suppositories. And what that is a compound that is made into a pellet that is placed into the distal part of the urethra, the very end where men urinate from. That pellet is then dissolved, and the medicine goes from the urethra to the erectile bodies to dilate the blood vessels, again, to cause an erection. It is a reasonably effective therapy for men with mild erectile dysfunction, and it does not work very well for men with significant erectile dysfunction. There is a penile revascularization that is rarely used today. It is mainly for young patients who have trauma to the pelvis or chronic perineal trauma. The success rates are about 66%. But in today's age, we rarely do those nowadays. There is a venous ligation surgery, which not very many people do anymore because of such very low success rates. We know from early studies from the mid-1990s that probably only 10 to 20% of men sought treatment for erectile dysfunction. Now that the new medicines, the oral medicines, are released, we think it's probably higher, but we still think that only 50% of men really seek treatment, mainly because of embarrassment or fear of failure. So there's still more men who can benefit from the treatment that we have.
When should a man seek attention for his erectile dysfunction? When he feels he has a problem. When he is not satisfied with the quality or length or duration of his erection.
Well, I think that there's hope. I want all men who have erectile dysfunction to know there's hope. And we can almost always help them have erections, whether it's with a medicine, with a pill, with an injection, with a vacuum pump, or a prosthesis. There are always ways that we can help them get back to that sexual relationship that they used to have. And even with the pills, if you fail the pills, there are often ways that we use combination of therapies, whether it's a combination of medications, combination of pills and pumps, where we can help them get back to having better erections like when they were younger.